Brought to you by Covered California.
A recent study finds Botox may be the key to treating depression. A dermatologist found when he injected his depressed patients with Botox, a majority saw their moods improved, and likely not just because they simply liked the way they looked. Joining us to look further into this idea is Dr. Sabrina Fabi from UCSD. Thank you so much for joining us, Dr. Fabi, as always.
Thank you for having me, Jen.
All right, let's talk about this because this study is really fascinating to me. The idea of if you look better, you feel better, but this study seems like it's more than that.
I mean, I'm really excited as a cosmetic dermatologist who performs this treatment on a daily basis to actually be able to participate in making my patients feel, not only look better, but feel better. And really what he saw in his study when he treated over 74 patients was that when he relaxed those muscles that are commonly used to express sadness or anguish or anger, that patients felt 50% less depressed. And so it's a great treatment because even some of the antidepressants that we presently have that are orally given don't even have that great of a success rate.
Yeah, so in that case then, are you essentially correlating that basically if you smile more, then the happier you are? Is that kind of what he's inferring?
Well, that is, and it's what we've seen even with Darwin's research back 150 years ago, where he saw that we use these facial expressions to be able to convey how we feel to each other. And so the thought is that if you can attenuate some of that actual expression, then you may not be able to feel that expression as much. And if you're able to amplify that expression, then you may be able to feel it even more. And so the thought here is that if you're able to relax the muscles, then you may not be actually able to feel the sadness or the anguish or the frustration as much.
Right. Dr. Fabi, talk to me a little bit about the impact of these results. I did a little bit of research. 20 million Americans in this country have depression, and a third are resistant to sort of traditional forms of treatment, either therapy or medicine.
That's a big number. We're talking about 15% of the U.S. population, 350 million people worldwide, and it's actually the leading cause of disability internationally. And so when you only have about a third of people that are not responding to these drugs, so that's only 2/3 of people that do respond, and a third that do not respond to the typical drugs that you take orally or even to just psychotherapy, it can get a little frustrating. And so obviously companies are always looking for alternatives to be able to offer their patients because it's still a leading cause of disability.
All right, so what would you recommend for people if someone is feeling sort of depressed? Should they run out and get Botox, or what's sort of your insight for them?
Well, I'm happy to see them, but the point is that we haven't done larger studies that are really required by the FDA to get this approved as a treatment for depression. So right now it would be off-label treatment for depression. Presently, we don't know if Allergan is conducting studies to get its FDA approval for the treatment of depression, but based on these 3 small studies that have been done, some with as many as 74 patients, the results are promising. People are seeing 50% decrease in their depression. So if you can imagine, if you can combine this with your oral antidepressants, you may be able to even see 100% decrease in symptoms of depression.
Yeah, well, and especially for so many people who this is such a real thing that they deal with, if there's just another option for them. Plus, if it can get rid of some wrinkles in the process, sounds like kind of a good deal. Dr. Fabi, thank you so much.
Thank you for having me, Jen.
All right, well, cancer is now the #1 cause of death in